Have you ever wondered about stomach cancer? What causes it? What the early warning signs are? And most importantly, how you can lower your risk? By learning the early signs and prevention strategies, you can save your life. Watch this video to arm yourself with crucial knowledge to stay one step ahead. Welcome back to Medical Minutes. Before we dig into the details of stomach cancer signs, diagnosis, treatment, and prevention, don't forget to like this video and subscribe to our channel for more informative health content that could make a real difference in your life. So what exactly causes stomach cancer to develop in the first place? It all starts with a genetic mutation in the DNA of the cells lining your stomach. This mutation causes the cells to grow and divide out of control, eventually forming a cancerous tumor mass instead of dying off like normal cells would. While the exact trigger of this DNA mutation isn't known, researchers have identified several factors that seem to increase a person's likelihood of developing stomach cancer. Having a family history of stomach cancer, an infection with Helicobacter pylori, H. pylori, bacteria, chronic conditions like gastroesophageal reflux disease, gastritis, and stomach ulcers, infection with Epstein-Barr virus, a diet high in fatty, salty, smoked or pickled foods and low in fruits and vegetables, frequent exposure to substances like coal, metal, and rubber smoking or chewing tobacco, heavy alcohol use, obesity, certain genetic syndromes like Lynch syndrome and hereditary diffuse gastric cancer. Additionally, some demographic factors put you at higher risk, including being over age 65, being biologically male, having an ethnic background that is East Asian, South Central American, or Eastern European. The good news is, even if you have one or more of these risk factors, it doesn't mean you will definitely get stomach cancer. But it's important to be aware of your risk level so you can take preventive steps and stay alert for any early warning signs. We'll talk more about prevention later on. Early signs and symptoms. One tricky thing about stomach cancer is that it often doesn't cause noticeable symptoms until it reaches a more advanced stage. Even the most common early signs, like unexplained weight loss and stomach pain, typically don't show up right away. That said, the key symptoms to be on the lookout for are loss of appetite, difficulty swallowing, unusual fatigue or weakness, nausea and vomiting, unexplained weight loss, heartburn and indigestion, black, tarry stools or vomiting blood, bloating or gassiness after eating, stomach pain, often located above the belly button, feeling full very quickly, even after eating a small amount. It's important to note that many of these symptoms are common to other, less serious conditions too. But if you experience any of them persistently, especially if you have certain risk factors, it's always best to get checked out by your doctor to rule out stomach cancer or catch it as early as possible. As the disease progresses, you may be able to actually feel a tumor mass in your stomach. More commonly, though, you'll notice sensations like frequent stomach swelling, fullness, or worsening pain that may have started out mild. The pain tends to intensify as the cancer advances. Diagnosis and staging. If you go to your doctor with concerning symptoms, they will start by getting your medical history, doing a physical exam to check for any palpable stomach masses, and likely ordering some tests to determine if you have stomach cancer. One of the most commonly used diagnostic tools is an upper endoscopy. In this procedure, the doctor inserts a thin, flexible tube with a tiny camera on the end down your throat and into your stomach. This allows them to visually examine your stomach lining for any abnormalities. The endoscope also has a special tool to take small tissue samples for biopsy if anything suspicious is seen. An endoscopic ultrasound is a special type of endoscopy that can help determine the cancer stage by showing how deeply it has invaded the stomach wall. Other imaging tests like CT scans, barium X-rays, MRIs, and PET scans are used to look for signs that the cancer may have metastasized or spread to other organs. Sometimes, if imaging doesn't provide definitive answers, the doctor may need to do an exploratory surgical procedure called a laparoscopy, using a small camera inserted through an incision to directly visualize the abdominal organs. Blood tests are also used to check organ function, since impaired function can indicate the cancer has spread to that organ. All of this information is put together to determine the stage of the cancer, from 0 to 4. Stage 0. If cancer is confined to the innermost lining of the stomach, stage 1. if cancer has spread to the next layer of the stomach wall. Stage 2, if cancer has spread to the muscular layer of the stomach wall. Stage 3, if cancer has spread to the outer layer of the stomach and possibly nearby lymph nodes or organs. Stage 4, if cancer has metastasized to distant organs like the liver, lungs, or bones. Screening for stomach cancer isn't routinely done, it's relatively rare. But if you're at high risk due to a predisposing condition, your doctor may recommend regular upper endoscopies to catch any precancerous changes as early as possible. Treatment. Treatment for stomach cancer depends on how far it has spread, your overall health, and your personal preferences. You'll likely work with a multidisciplinary team including your primary care doctor, oncologist, cancer specialist, and gastroenterologist to determine the best plan. Surgery is the main treatment. If caught very early, when still confined to the superficial stomach lining, the cancer can sometimes be removed entirely through an upper endoscopy procedure called an endoscopic mucosal resection. In most cases, a more extensive surgery called a gastrectomy is needed. This may be partial gastrectomy, removing just the cancerous portion of the stomach, or total gastrectomy, removing the entire stomach, with the esophagus then reconnected to the small intestine so you can still eat and digest food. Additional treatments are usually given alongside surgery to directly attack remaining cancer cells. Chemotherapy uses powerful drugs to shrink tumors pre-surgery or kill leftover cancer cells post-surgery. It's typically combined with radiation. Radiation therapy uses targeted high-energy beams to destroy cancer cells. It's not effective alone, but can enhance chemotherapy before and after surgery and help relieve symptoms. Targeted drugs home in on and exploit specific weaknesses of cancer cells, causing them to die off. This approach is often used together with chemotherapy for recurring or advanced cancers. Immunotherapy harnesses your body's own immune defenses to seek out and destroy elusive cancer cells. It's usually reserved for late-stage or recurrent cancers. Palliative care is a crucial part of treatment for many stomach cancer patients. This specialized medical care focuses on maximizing quality of life by managing symptoms and providing support to complement care from your main doctors. It can be received along with curative treatments. Stomach cancer is a serious diagnosis, but treatment advances mean there are more options than ever before for successfully fighting it, especially when caught early. Work closely with your care team to fully understand the benefits and risks of each approach. Prevention. While you can't completely prevent stomach cancer, you can significantly reduce your risk with some key lifestyle choices. Get tested and treated for H. pylori infection. This bacterial infection is strongly linked to stomach cancer, so eradicating it promptly if present lowers your risk considerably. Don't ignore stomach issues. Chronic stomach conditions like ulcers and gastritis, especially when caused by H. pylori, increase stomach cancer risk if left untreated. See your doctor for proper diagnosis and care. Eat a healthy, balanced diet. Lowering your intake of fatty, salty, smoked, and pickled foods while bumping up fruits and vegetables can cut your risk. Aim for nutrient-dense options high in vitamin C, beta-carotene, and carotenoids like citrus fruits, leafy greens, and carrots. Avoid all tobacco products. Both smoking and smokeless tobacco increase stomach cancer risk along with many other cancers. If you currently use tobacco, ask your doctor about cessation aids. Maintain a healthy body weight. Excess weight is a risk factor for stomach cancer. Focus on eating right and staying active to keep your weight in a healthy range for your body. Your doctor can advise you on an appropriate goal weight. Stay on top of recommended stomach cancer screenings, especially if you're at higher risk. Catching precancerous changes or cancer at the earliest stage possible makes a big difference in treatment success. While a stomach cancer diagnosis is never welcome news, knowing what to look for and taking proactive steps to reduce your risk can help you protect yourself as much as possible against this disease. And there you have it, a video guide to understanding the early signs of stomach cancer and how you can take early steps to lower your stomach cancer risk. And if you liked this video, be sure to like and subscribe to Medical Minutes for more essential health information you need to know. Stay informed, stay healthy, and stay tuned for our next Medical Minute.